Colon cancer is now becoming an increasingly common malignancy in today's world. However, the good part is that the treatment is there and the treatment is successful in most of the cases. Now, whenever we talk about colon cancer, surgery forms the mainstay of treatment. That is, in most of the cases, practically almost all of the cases, surgery is needed. So how do we go about with the surgery? There are mainly two types of surgery. One is the traditional or the open method, wherein a long incision, around 20 centimeter long incision or wound is made, the entire abdomen is opened, and then we perform the procedure. And today, gradually with the advent of modern technology, what is becoming increasingly common is a laparoscopic method. So what is laparoscopy in case of colorectal procedures? Basically, we make a few small holes on the stomach. We pass a camera, we pass instruments, and then we perform all of the same things which we previously were doing in an open procedure. What are the procedures that we do? So surgery for colon cancer basically depends on where exactly the cancer is or the location of the tumor. There are a number of procedures. Say if it's there in the right side of the colon, it's known as a right hemicolectomy. If the tumor is present in the left side, the procedures are left hemicolectomy or a left extended hemicolectomy. If the tumor is much lower down, that is in the rectum, that is towards your anal canal, then there are procedures known as an APR or an LIR. So these are technical terms, but what we need to understand is all of these procedures can be done laparoscopically. Now, why would anyone go for a laparoscopic procedure? What are the benefits? Firstly, it gives minimal pain to the patient as compared to open surgery. The bleeding is minimal. It gives a much better visualization of the structure because we have a camera wherein the image is absolutely magnified. The patient has an excellent recovery as compared to open surgery. The hospital stay is much lesser. The patient starts moving around and performing all normal activities very soon as compared to an open procedure. The medicines, the painkillers that are used are much lesser in case of a laparoscopic procedure, and infection rates are also seen to be much lesser because you have small holes compared to a very long incision which needs a lot of dressing and a lot of medicines, etc. What are the problems with laparoscopic surgery? Firstly, laparoscopic surgery cannot be performed everywhere. We need a hospital where the proper infrastructure, proper hardware, proper instruments are there. Obviously, since it's an advanced procedure, it might be slightly more expensive compared to the traditional surgery. One major problem with laparoscopic colorectal surgery is it requires a lot of skill. So the learning curve is pretty steep. So people who are performing need to be properly trained before they can actually start performing the surgery. Today, there are very few laparoscopic colorectal surgeons in the country. However, the ones who are there are performing excellent cases and we have excellent recovery rates. To be, very fair, there is not a single case which cannot be done laparoscopically in terms of colorectal procedures. Today, all the colorectal procedures can be very well done with the laparoscopic method, but the proper skill training has to be there, proper infrastructure has to be there. Technically, it's a challenging thing, but if done by skilled hands, it provides excellent results. Thank you.